We're going to have a talk on high-intensity focused ultrasound HIFU in treatment of uterine fibroids. Uterine fibroids are the most common benign tumors of the female reproductive system and pose a major socioeconomic problem on the health system. 30 to 55% of women aged 35 and older have uterine fibroids of a significant size. Almost 50% are symptomatic. Heavy menstrual bleeding. What are the main symptoms? Are heavy menstrual bleeding, pelvic pain, and dyspareunia, urinary frequency, infertility. They constitute the most common reason for hysterectomy worldwide. What are the classifications of fibroids? Funaki suggested the classification of fibroid according to the T2 signal intensity in the MRI. There are three major types in fibroid classification. Type 1, which is the low type, which is comparable to the skeletal muscle, meaning that it is of low vascularity. Type 2, which has intermediate vascularity, which is lower than the myometrium, higher than the skeletal muscle. And type 3, which has the higher vascularity, which is equal or higher than the muscle. And meaning that these are the type 3 is the type that doubles in size regularly and grows to large sizes. And as we all know, these are the sites of the known most common sites for fibroids: intramural, intracavitary, pedunculated, submucous, and subserous. What's the common management of fibroids? Usually it's observed and patient takes medical treatment. Currently in the old age, in the patients above the age of 45, they usually go for hysterectomy. In the females, and we don't consider them patients actually. In the females less than the age of 45, they usually go for myomectomy, and there is minimal invasive, which is the UAE, uterine artery embolization. And currently, in the last decade, now we have high-intensity focused ultrasound, which is considered completely non-invasive. HIFU stands for high-intensity focused ultrasound. It started way back in the 40s when Lin proposed the concept of using HIFU. And in the 50s, actually, they started to do experimental trials on HIFU in treatment, not just in fibroids, in different other domains. The technology is based on focusing the ultrasound on a specific point, and in this point, the heat focuses in this point, and then the rise of the temperature occurred, reaching up to 100 degrees centigrade, where coagulative necrosis occurs. The focal point is a very small point, so the idea depends on ablation of a focal point besides a focal point to make a line, and then a line after line to make a plane, and putting these planes together you ablate a whole volume, and this is how a volume is ablated. There are two means of reaching the fibroid with HIFU treatment. It's either ultrasound guided or MRI guided. So the ultrasound treatment is guided by two modalities, ultrasound and MRI. The most common machine used for ultrasound is the HIFU machine, which is a Chinese machine. And the most common MRI guided is Incytec by GE and Sonelev by Philips. MRI guided technology is an integrated MRI diagnostic machine with the treatment ultrasound machine. HIFU functionality integrated in a separate table slides over the standard MRI patient table. As you can clearly see here, this is the ultrasound, this is the MRI table, and it has to be a specific MRI machine in order to be able to integrate. And then the treatment machine, as you see here, the table, it goes inside on the treatment table, and then you remove it after the treatment and you return back the diagnostic MRI table. That's why not all MRIs are compatible to do HIFU treatment. What's the advantage of using an MRI guided HIFU? Of course, it's target treatment. The main advantage that MRI guidance helps is that what's called temperature mapping, means it gives us the privilege to measure the temperature, not just of the tumor and the ablation focal point, but of the skin and the underlying muscle. So it helps safeguard the patient from increasing the temperature during treatment. It's completely non-invasive, no skin incision, no ionizing radiation, very minimal rate of complications, and the patient, early ambulance, the patient goes home after 2 to 4 hours post-treatment. The technique is, this is the MRI scanner here, and the patient lies prone on the transducer, where we have a thin layer of degassed water, and the ultrasound crystal just gives out the waves specifically to the focal point, and treatment takes place on each ablation. Now we go back to the ultrasound guided. This is the HIFU machine, the Chinese HIFU machine, the ultrasound guided machine, where you have a table here and you have the water system. The patient lies, it's formed of a treatment table, as you can clearly see here, a central console where there's the computer and the guidance system, and an auxiliary system, which is a water system. You have a water pipe through the room, and inside the water pipe, it feeds a small tank where the patient's abdomen is in this tank, and you have degassed water with temperature reaching up to 5 Celsius. It has to be very cold in order to cool the skin to counter effect the heating inside the uterus. Advantages of ultrasound guided is almost the same as MRI, except that there is no temperature mapping, but it's ultrasound guided. You see the response immediately on the table. It's also one-time treatment. It's ultrasound guided. It helps in activation of the immune system from the hyperthermia, and the same thing, no skin incision, early ambulance, patients go home after a few hours. This is a small video showing our ultrasound. It's a quick video showing how the treatment works. Here the patient lies down prone. You can clearly see the fibroid. This is the tank, and where it has degassed cold water. And then the ultrasound waves, you focus it live during work live. You focus it on the fibroids without affecting the overlying skin or subcutaneous tissue or muscle. And you just ablate a point and a point, forming a plane and a specific plane, and then you ablate the whole volume without affecting the rest of the uterus. And of course with no skin incision and no other intervention procedures. How do you see your response? In MRI guidance, the response is, whether MRI or ultrasound guided, it's called the non-perfused volume, meaning the volume of the area that had coagulative necrosis. It's very important to measure the non-perfused volume in reference to the whole fibroid volume. This is the non-perfused volume ratio, in which you can standardize see the effect of the treatment, and you compare it to the clinical response to the patient. And it's a key indicator of clinical success. On MRI, you just inject contrast post-treatment, and you can see this is the coagulative necrosis, and you can compare it to the whole volume of the fibroid. On ultrasound guidance, on table, you see this is the fibroid, and during treatment, you see what's called the grayscale changes. And whoever is working RF or microwave will see that it gives the same response as you see during microwave and RFA ablation, and it just gives a hyperechoic signal. Sorry. We do not have contrast enhanced ultrasound, but everywhere else they use contrast enhanced ultrasound to see the effect of HIFU treatment. Also with the patient on table, you see here the enhancement of the fibroid, and post-treatment you can see that the fibroid is very well ablated. In our national institute, we have an MRI machine. In Egypt, we have two machines. We have both MRI and ultrasound guided. In our, we recently got an MRI machine in our liver institute. We had our first 20 cases experience. Now we have more than 50, but this is our first 20 cases. We have a written informed consent to use MRI guided. These 20 cases had 30 fibroids, the range of the size from 3 to 12 centimeters. And we did a post-MRI with the patient lying prone on the table in order to compare pre and post procedures and measure the volume of the non-perfused volume. Our average age was 28 years. And of course, the most common fibroids were the intramural fibroids. And also we had few submucous. And most of them, of course, are type 1 because it's of low vascularity and it's less challenging to treat, but we had few of them with type 3 which were very challenging actually to treat. And the average size is 6 centimeters. The main symptoms that we had are, of course, menorrhagia, in most of our cases. Some cases we're doing it for primary infertility, and some cases we're doing it for urinary symptoms. Most of the patients, we had a more than 90% relief of symptoms of the patient, which is usually menorrhagia or pain in the first 3 months, and we had a non-perfused volume for more than 70%. The best scenario is to have it more than 80%, but usually the symptom relief is more than 70%. These are few cases done here in Egypt. First case is the 32-year-old female married with 3 kids, having heavy menses on medical treatment, and her hemoglobin dropped down to 7. And this is pre-treatment. You can see the fibroid anterior wall here, and this is post-treatment. You can see the non-perfused volume here with good results, and the NPV is 73%. This is another second case, is a 42-year-old lady married with 2 children, heavy, of course, heavy painful menses. Her pain score was 8, and dyspareunia and frequency, and her hemoglobin dropped to 8. Follow-up showed score still 5, and significant improvement in other symptoms, with the rise of the hemoglobin being 12. And as you can clearly see here, she had a good MPV of 62%. In such a case, we could give her another session if the symptoms are still returning or increasing. This case, we had a 39-year-old lady. She's not married. Menses is regular with only slight increase in amount. She had lower abdominal pain. Follow-up showed improvement in her pain score. Here is the ablation area here, and of course, as you can see, also it compresses the bladder and could cause some frequency. Even the patient cannot correlate between the frequency and the fibroids sometimes. They might think it's mild duty infection or something. This is a 48-year-old female with the 2 children. She had heavy menses, and she had hemoglobin drop, and she used to be admitted in the hospital for blood, and her pain score significantly improved, and her ablation, her MPV was 74%. This was a very interesting case. This is a 42-year-old lady married with 1 kid. She had heavy menses. Her hemoglobin dropped significantly. She used to be admitted every 2 or 3 months for hemoglobin, for blood, and now she has 0 pain score. She had a fibroid. It was, of course, submucous, and it was very well ablated with nearly almost 100% MPV. And then this is immediately post HIFU, and then 1 month post HIFU, we found the fibroid in the lower uterine segment in the cervix, and then immediately 2 months post HIFU, the fibroid just was discarded from the uterus, and her uterus returned back to, as you can clearly see, to a normal sized uterus with no fibroids in it. And she's living completely normal with no pain at all and no bleeding at all. Our conclusion is that HIFU is a safe, non-invasive treatment option for uterine fibroids with low risk, minimal complication. The larger the MPV, the better the results. Proper patient selection is important. MRI is associated with significant relief of patient symptoms. Our first experience is very promising. More work is needed, and more challenges in cases is needed. This is our team in the ultrasound guided HIFU unit, and this is our team in the MRI guided HIFU unit, and this is our MRI guided HIFU machine. Thank you very much.
Thank you, Professor Mohamed, for this very nice